Welcome back. Dr. Diana Corzine with the VA Medical Center Sleep Clinic to talk with us more about sleep health. Thanks for sticking around.
Absolutely, my pleasure.
So could you tell us a little bit more about, you said there were over 80 sleep disorders. Can you talk about some of those, maybe some of the more common ones?
Sure, yeah, and there's probably about 6 different common types that we usually talk about. One of them, the most common, is sleep apnea, insomnia, circadian rhythm disorders, something called parasomnia, which is like a sleep movement disorder, a restless leg syndrome, and narcolepsy. I think sleep apnea is common and worth talking about a little bit more. And in particular, it's where a person stops breathing during their sleep. And in obstructive sleep apnea, that's where the airway kind of collapses down. But when that happens, the brain sends adrenaline to tell you to wake up and breathe. And those adrenaline surges are what really disrupts the sleep and increases the stress during sleep, when sleep is supposed to be a time of rest and rejuvenation. Your oxygen can also drop when you have that airway collapse. And again, that increases the risk for a lot of people for poor sleep, not feeling good, and then things like stroke and heart attack. Not treating sleep apnea increases your risk of hypertension, heart disease, atrial fibrillation, congestive heart failure, and coronary disease. So it's very, very important to treat sleep apnea. The treatment for sleep apnea is commonly something called CPAP, or continuous positive airway pressure. And so that's an important one to know about. Insomnia is also very important. And that's the inability to fall asleep or maintain sleep. And it usually, the definition occurs that it's happening more than a month and affecting your function, because all of us can go through times when we don't sleep very well. There are certain sleep disorders that can add to insomnia, like obstructive sleep apnea and restless leg symptoms, but other factors such as depression and anxiety, as well as an irregular sleep schedule, caffeine, tobacco, and alcohol add to insomnia. Circadian rhythm disorders, that's things like jet lag, or patients that have shift work and they vary their sleep and wake time. That's very disruptive to sleep and can be difficult to treat as well. Movement disorders in sleep, like parasomnia, such as walking, talking, or nightmares, or acting out your dreams, are another kind of sleep disorder. Restless leg syndrome is a symptom where patients have to move a lot and move their legs prior to falling asleep, and it makes insomnia worse as well. And then narcolepsy is where there's sleep-wake instability. So patients who want to be awake, but suddenly sleep intrudes and they fall asleep without control, or even when they're sleeping, awake intrudes in their sleep. So that's a teeny tiny tip of the iceberg when it's talking about sleep disorders, but those are kind of the most common.
And you mentioned the CPAP for treating sleep apnea. What are some of the other treatments that folks can get for sleep disorders?
So great question. Melatonin can help with circadian rhythm disturbance, but it's not something that patients often think it's an over-the-counter. You can just sort of take it in a particular as needed, but it should be taken in a particular way to help those sleep disorders. Some medications can help with sleep, but really important also is something called cognitive behavior therapy for insomnia, and that helps change how we think about sleep and improve our sleep schedule. So that's very, very important. Lifestyle changes are key to improving sleep. Again, having a regular sleep schedule, getting enough sleep, avoiding tobacco, alcohol, and caffeine, and then avoiding screens prior to bedtime. The blue light in screens can really affect our sleep and delay our own internal melatonin.
Okay. So we've talked about sleep disorders and their treatments. Is that what you do at the VA, or can you talk a little bit about what you do and what is a sleep clinic?
Great question. So yeah, I am the chief of the sleep medicine service for Montana VA, so that's over the whole state, and we have a 4-bed sleep lab. So we do in-lab studies. We also do home testing. We do something called nocturnal oximetry, checking oxygen as well, and we also have CPAP clinics, so respiratory therapists who help patients with the equipment and set up the CPAP. We do a lot of telehealth visits and consultations, both in person but then also telehealth, because we may see patients in Plentywood, and we're here in Helena. And we treat all of those different disorders, and in particular sleep apnea, insomnia, PTSD-related problems with sleep, nightmares, restless leg, things like that.
So you are at the VA, so obviously you work with veterans. Is that a population that particularly suffers from sleep disorders?
Yeah, there's an estimate that veterans in general, there was a recent study that suggested that almost 25 to 35% more likely for veterans to have a sleep disorder. And this is particularly for patients who've had combat experience, but even without combat experience, veterans are 3 to 4 times more likely to have sleep apnea. Veterans do tend to have more medical issues, and that can add to sleep apnea as well as compared to the general population. And then, of course, there's PTSD and insomnia that adds to it. And a recent analysis of a veteran sleep diagnosis from 2010 showed a 6-fold increase in sleep disorders in veterans, the most common being sleep apnea and insomnia.
Okay, so we are just about out of time, but do you have any tips on, number one, how much sleep do we actually need for good health, and how can we get that good sleep?
That's a great question. So how much sleep you need really depends on your age. So in infants, you need about 12 to 16 hours. Children, 1 to 2 years, 11 to 14 hours. Children aged 3 to 5 years, about 10 to 13 hours. And then I'll jump to teens. Teens need about 8 to 10 hours a day. That's an important topic that we can talk about at another time.
Okay.
But adults usually need about 7 to 8 hours of sleep. And getting that regular sleep schedule is a really good idea, as well as avoiding tobacco, alcohol, and caffeine.
Great. And you mentioned the screens too. Stay off those
Staying
screens.
off the screens also really important, particularly for those teen patients, particularly prior to bedtime.
Okay, great. Thank you so much for being here,
My
Doctor. A
pleasure.
lot of great information. We appreciate it. Up next, one person's personal experience with trying to improve her sleep and overall health. We'll hear her story right after this. Stay with us.